We've seen it before. In the waning days of World War I, soldiers started getting sick with the flu that killed. Before it was over, millions had died worldwide from a pandemic that only ended after the disease had run its natural course. Today, we have new medicines, but we also have new vulnerabilities. We continue by looking at what many fear could turn into a pandemic and why so much work is underway to protect us from the ravages such a disease outbreak could bring. Under a microscope, it's only a tiny ball covered with knobs and bumps and hardly worthy of its reputation as a mass killer. Yet scientists warn that the flu strain H5N1, known as avian flu, could be as deadly as nuclear war. Originating in the Far East, the poultry virus kills more than half of all infected.
I think it's important to emphasize, however, that there is no evidence at this time that H5N1 virus that's currently circulating in Asia is in the U.S., either in birds or humans. Again, no evidence that it's in birds or humans in the United States at this time.
But scientists fear it's only a matter of time before the virus mutates and becomes transmittable from human to human, making avian flu just an airline flight or a cough away. Such an outbreak has happened before. In the waning days of World War I, an influenza epidemic swept the globe, killing 50 million people and triggering an international panic. And just as then, today's avian flu has no known cure, only control.
As a primary safeguard, APHIS maintains trade restrictions on the importation of poultry and poultry products from all affected countries.
In addition, the U.S. has conducted this summer the largest scale surveillance of migratory birds in our history, all in the hopes of getting an early warning if the bird-borne disease spreads here.
The strategy is to test at least 100,000 birds, and that'll be a combination of samples. It will be some testing of some captured live birds that are of some very targeted species where the birds can be swabbed and then released into the wild again. Other efforts will focus on hunter-killed birds during the hunting season, and then some are just done through investigations of bird die-offs.
Kristy Bradle is the state public health veterinarian for the Oklahoma Department of Health and says that $29 million is being spent nationwide for wild bird surveillance. Yet she knows a major piece of the prevention puzzle is still missing.
The most significant tool in our toolkit is an effective vaccine. That's the way we traditionally deal with seasonal influenza, and it also would be the way we would be able to contain a pandemic influenza strain. But influenza vaccines have to be very closely matched to the circulating virus, and until we know exactly what that pandemic influenza strain looks like, we cannot begin development of a vaccine.
According to Bradle, it could take 4 to 6 months after the virus has been identified to produce enough vaccine to even distribute throughout the U.S., leaving containment against the spread of avian flu as our only option. Becky Brewer is Oklahoma's state veterinarian.
The commercial industry has been very, very quick to jump on that bandwagon, and there's not a single flock that is produced in Oklahoma that isn't tested for avian influenza, both high path and low path.
And Brewer says that if avian influenza is found in an Oklahoma flock, a response team would quarantine the area in as little as 2 hours.
Biosecurity is the number one leading thing that folks who raise poultry can do to protect their investment and also to protect the Oklahoma flock.
Agriculture Secretary Mike Johann says the detection of H5N1 in wild birds will not necessarily mean the virus will reach commercial poultry flocks. And even if it did, the federal government is also ready.
We would immediately establish a quarantine area around the infected birds and restrict movement into and out of that area to prevent the further spread of the virus. 2, we would humanely destroy the birds and disinfect the area. 3, we would step up testing throughout the region to ensure that the virus does not spread. And 4th, the quarantine would be lifted only when tests confirm that the area is free of the virus.
All preparation for a disease that is yet to be discovered in the United States. But with no known vaccine, its work state and federal officials are taking quite seriously.
So we need to be aware, we need to be prepared, but we don't need to panic.